All right, let's look at a case together. This patient came in with crowding. She's got some crowding on the top teeth, crowding on the bottom. I'm going to ignore this situation because at home clear aligner companies, they will probably admit that they can't correct this by making the tooth upright, but any at-home clear aligner company will probably tell you that the upper and lower teeth can be corrected as far as crowding is concerned. They can be made straight. And let's see if that's true, and if so, what is the result going to look like? And so one important thing to realize when it comes to clear aligner companies is that there are certain procedures that they're not capable of performing because they require having a dentist on site. At least in my state of Minnesota. These procedures are, for example, placing attachments, and I'll show you an attachment here. Hopefully the camera focuses on it. If you look real close, you'll notice a little nub sticking out of the tooth right there, and I'll show you on the screen what it looks like. They're basically buttons or handles made of tooth-colored material, so kind of like what you would have when you go to your dentist for a white filling. Let's add an attachment to this tooth, for example. This is what it would look like as far as the shape, but not the color. They're not gray like this, they're tooth-colored. But the concept is that the clear aligner needs something to grab onto to achieve certain movements. There are movements that clear aligners can achieve without attachments, but there are a lot of movements that clear aligners cannot achieve without attachments. And so this is why your orthodontist or your dentist would place attachments on certain teeth when you get clear aligner treatment. But at home, clear aligner companies are not able to place or remove them because they don't have a dentist on site to do that for them. And so without being able to place attachments, movements such as what we call extrusion, bringing teeth together to meet, so upper teeth down, lower teeth up, this is called extrusion. This is not something that clear aligners can achieve without having attachments on, because you need some form of an undercut on the tooth for clear aligners to grab onto to bring the tooth down if it's a top tooth, or bring it up if it's a bottom tooth. Another movement that clear aligners are not able to achieve is rotation. Sometimes the tooth is twisted. For example, this tooth right here is twisted a little bit, and this tooth is also twisted. If we're going to be able to correct a twisted tooth with just clear aligners without attachments, the tooth itself has to be pretty wide so that a clear aligner can grab onto it and twist it. But if it's a round tooth, like a canine, for example, this tooth, then for a clear aligner to be able to grab onto it and rotate it is going to be pretty impossible. And so derotation or untwisting teeth can correct some teeth depending on their shape, but some teeth also are not correctable as far as that's concerned. Another limitation for not having attachments on is angulation. So if you have two teeth that are where one is doing this and the other one is straight, you want the one that's not straight to be parallel to the one that's straight. Then without having an attachment on that tooth to, like a handle for the aligner to grab onto and untwist the tooth, it's going to be very, very difficult to achieve that movement. An example in this case is this tooth. We would like to be able to untwist it like this and bring it down like this. But without having an attachment on it, this is going to be very, very hard, nearly impossible actually. And so that leaves us with one of the two things that clear aligners are really good at, which are splaying your teeth out if they're crowded, or crunching them together if they're spaced. That's really what they mainly do, splay out or crunch in. And that is definitely enough to make the teeth straight and make them so that there's no crowding or spacing in between them. But it does come with consequences if we don't employ other things like attachments, rubber bands, interproximal reduction, or being able to extract teeth and incorporate extractions into the treatment plan. All four of these things are things that clear aligners are not able to do if they're the kind that's at home. And so looking at this arch from the bottom, clear aligners can move the teeth in the front into a wider arch so that instead of them being crowded like this, if we move them into a slightly wider arch, it's hard to draw with a mouse, then we can resolve the crowding. And so let's see what that would look like. This is what it would look like at the end of treatment. Teeth are nice and straight if you look from the bottom, but if you look from the front, this tooth, which needed to come down and to be de-angulated, a clear aligner alone with no attachments is not able to do that. So this is what the upper arch is going to end up looking like. For the lower arch, this is what the lower arch looks like now, and again, by just splaying out the teeth so we can move them from an arch that looks like this into an arch that looks more like this. This is what that's going to look like. Teeth look nice and straight from the top, but if you look from the front, there are discrepancies that are not resolvable with just clear aligners. Like, for example, how this tooth steps up in comparison to this tooth. They're not straight across, and that's because to correct this, you need to bring this tooth down a little bit and rotate it a little bit, like so. Bring this tooth down also, and this would look a lot straighter. But clear aligners will not be able to do this without attachments. Now, the other thing to keep in mind is that as you splay the teeth out, as you move them outward from a crowded position, you're not able to achieve what we call bodily movement, which is tooth and root together moving outward. What you can achieve with clear aligners with no attachments is just tipping them out like this. So they, instead of moving out like this, they tip out like this. They're very good at splaying the teeth out, maybe achieve a little bit of bodily movement, but not as much as the actual, what we call proclination, or the leaning forward of the teeth. And this tipping comes with an opening of the bite, basically just like saloon doors. When you push them out, they open. When you push them together, they close. And so clear aligners in this case, by splaying the teeth out on the top and on the bottom, the case is going to go from looking like this in the beginning to looking like this in the end, where the bite is now open. That's a consequence of that type of splaying out movement that at-home clear aligners are good at achieving. Now, if this patient goes to an orthodontist, in addition to placing attachments, we would incorporate rubber band wear. Rubber bands require buttons being placed on the teeth and are usually prescribed by an actual dentist or orthodontist that is supervising the case directly. And so at-home aligners are not able to incorporate rubber bands into their treatment. And so without rubber bands and attachments, it's going to be nearly impossible to bring these teeth together and have the bite be closed. And so this patient is getting her teeth straight when you look at them from the bottom if they're top teeth, or from the top if they're bottom teeth. But if you look at them from the front, you'll easily see the limitations, the things that clear aligners are not able to do, mainly like this tooth, these bottom teeth in the front, and the opening of the bite that's going to ensue. And so in this case, you will get the roots moving forward a little bit, but what you'll get more of is the roots leaning back and the crowns leaning forward to resolve the crowding. But that's really half the story. Next week, I'm going to go over 2 reasons why treating this case without good, detailed x-rays would lead to very, very bad consequences for this patient. So until then, see you later.